Pain is such a common part of chronic disease presentations that if you're looking after chronic illness in any patient population, if you're not addressing pain issues, you will be missing out on treating something that's really important to the people who are burdened by the pain. I first started working in Port Lincoln in 2012. I was seeing quite a lot of patients from Port Lincoln across in Adelaide. They'd fly over to see me. One of the allied health practices here asked if I'd be interested in doing some consulting work here. So that's how that started. In 2021, the South Australian Rural Doctors Workforce Association were looking at expanding their chronic disease program for First Nations, and they were looking for someone who could provide a service here in Port Lincoln because it covers a big population here. So we have quite a big First Nations population through the area. Importantly though, through the whole of the Eyre Peninsula, there's a relatively high First Nations proportion, and so there's a significant demand here for pain services throughout not just the local region but the broader Eyre Peninsula. There's a lot of subtleties in terms of the way that the Aboriginal health workers and our nurses and allied health providers from a First Nations background, that they make things work well here. They actually will, if you like, set the scene for me. Where there are some potential cultural misunderstandings, then they'll make me aware of that. They will do all kinds of things to, if you like, smooth the journey for people. So if somebody is, for example, unable to get here or is having difficulty getting here, they'll work out a way of getting them transported here. And corresponding, what it means is that we have a really good attendance rate at this clinic. When we've run patient review surveys here, they've been very positive. So people have been delighted to have a pain specialist here. First Nations peoples generally have a higher burden of chronic disease, and importantly, the chronic disease that they have is very frequently associated with pain. On a map, Port Lincoln may not appear to be that far from Adelaide. If you go by road, it's an 8-hour drive. The only other option is getting on a plane. And of course, you know, a plane journey for somebody with a chronic pain problem is often not very pleasant. In these regional, rural and remote settings, there are wonderful opportunities for training. Access to many things that people take for granted in metro regions simply isn't there. So you have to work out how you're going to deal with that and how you're going to help patients deal with that in a less well-resourced setting. That's a positive thing all round, and I think it helps as well with dealing and prioritising things, even when you are working in a well-resourced environment.